Okay. Today we are talking about palliative care consult services, how it is being developed. I am Dr. Bhanuja Wijayatilaka. I am the in charge palliative care unit, National Cancer Control Program, Ministry of Health. So as far as these palliative care consult services are concerned, so this is something new. Therefore, let me to introduce from the beginning. The National Palliative Care Program has two main components. One thing is the upper level and the lower level. Upper level, that is the palliative care consult services. So today we are going to focus on the upper part, that's the first component. So palliative care consult services are some special units that are to be established in tertiary and second level hospitals. And also it's a special service provided by a special team, palliative care team. So other component is community and home-based palliative care, which is provided at the primary healthcare institution level and the community level. I'm not focusing on that part today. So what is palliative care consult services? As I mentioned before, this is something new to everybody, and therefore it is very important to understand what is this palliative care consult services and what's the function, how it is being established, and what's the importance of establishing these special services. So palliative care consult services are actually a special units and a special team expected to establish in all tertiary and secondary level hospitals according to the General Circular 0134 2020 issued by Director General of Health Services. So all guidance actually has been given through this General Circular, and most of my facts are based on this General Circular in this presentation. In addition, it's good to understand this National Strategic Framework of Palliative Care also identifies the establishment of palliative care consult services as an essential task. Therefore, this is very important unit. All heads of the relevant institutions are expected to facilitate establishment of the palliative care consult services. Actually, palliative care consult services is expected to provide the holistic care. That means physical, social, psychological, and spiritual care. That's the principle of palliative care. Most importantly, integrated with health and non-health sector. That's the most important, crucial part. They are not working alone, so they have to work with health staff as well as non-health staff. So it's a teamwork, palliative care consult services. So then palliative care consult services are expected to make the referrals. When they are making the referrals of the patient, they have to make formal referrals with the care plan. This is very important. So we talk these things in my future slide to the relevant public health nursing officers through the heads of the primary medical care institution. So I'm using these two abbreviations, public health nursing officers and primary medical care institution. Always our advice is to refer to primary public health nursing officers through the heads of the relevant institution where public health nursing officers are attached. So this is the circular. This is the first page of the circular. Circular is available in our website as well as it has been sent to all tertiary and second level hospitals. It should be available in your hospital. How this palliative care consult service works? So this is very important to understand. It's a referral center. Patients can't walk in really because it's a place providing palliative care. Palliative care means a care provided for a special kind of people, patients who are suffering from almost uncurable disease condition. Therefore, the patient has to be identified and referred by the consultants. Therefore, second point says all consultants of the health institution are expected to refer patients who need palliative care to the palliative care consult services with well-informed consent. That's very important. So when anyone is referring patient to the palliative care consult services, the patient has to be informed and make aware, full aware what is his condition and what's the situation and what's the prognosis. That's very important to awareness of the patient before sending patient to the palliative care. And the referring consultant must liaise with the in charge of the consultant of the palliative care consult services for arranging palliative care for the patient. That means the referring patient consultant usually does not fully giving up the patient. Both uh, referring consultant as well as the in charge of the palliative care consult services are providing palliative care in harmonization. The referring consultant may work with palliative care consults team in providing palliative care for the patient. However, this is very important when a cancer patient is referred, a consultant oncologist must always be included in the care team because that's a special case. The team to develop a proper care plan is also very important, which is also called advanced care plan, before referring the patients to the primary medical care institutions or a public health nursing officers. Otherwise, a real expectation will not be taken place. So there must be a plan for medical officer in charge of the primary medical care institutions to follow what to do when such a patient is referred or when such a patient is turn up to their health institutions. Therefore, preparing this care plan is utmost important and it has to be done by the palliative care consult services level by a team of consultants and interdisciplinary team. So we'll see the key functions of the palliative care consult services. Uh, Provide holistic care, this provide social and psychological and spiritual care for those patients and inpatient consult services. Usually what is happening is when a consultant refer a patient in the same hospital, actually the team visits the ward and they assess the patient and they provide the care. Therefore, they are walk into the patients, not the patient come into the palliative care services. Usually, the team visit the wards and they provide inpatient consult services. Outpatient clinic visit services also can be provided. And also very important fourth point, conduct family meetings to aware the patient and family. So conducting family meetings are utmost important and actually there must be a good place, privacy place for conducting family meetings. To develop care plans, and also it is very important to develop care plans, I mentioned before. It is a teamwork actually. The team, mainly the two consultant, referring consultant, as well as the consultant in charge, medical officers, nursing officers, as well as other supportive staff, like maybe depending on the conditions, therapists, physiotherapists, maybe speech therapists, right? And also very importantly, especially when they're developing advanced care planning, the patients or a family uh, participation is very important for the sustainability of the plans and also for them to understand what is happening. That's very, very important. Coordinate with social service officers and the other relevant government and non-government officers, agencies to provide especially economical, psychosocial and spiritual support. These are the support actually usually patient does not get from the hospital. So they are patients in a very critical stage, maybe end of life stage. They can't work, they can't earn. So they are suffering from lots of economical, psychosocial and spiritual problems. So they need some kind of support. Therefore, the team from the palliative care consult services are expected to develop relationship with the social service officers and government and non-government officers from outside the hospital to provide this extended care for those patients. And it's important to develop a well-established referral system. It's been developed, supported by the NCCP and the National Cancer Control Program and the NCD unit. And it links with public health nursing officers through MOIC. Always, as I mentioned before, the referrals has to go to public health nursing officers through medical officer in charge, primary medical care institution or healthcare institution. and to develop close collaboration with the government and non-governmental organization, including hospices. There are few hospices in the country. Palliative cancer services are expected to work in collaboration with the hospices. And finally, very important point, training programs. So palliative care is something new, and it should be aware by all medical staff, hospital staff. Therefore, conducting training programs for caregivers. Hospital staff is very important. In addition, caregivers. Caregivers are the people who are looking after these patients. So, caregiver training also is one of the responsibility of this palliative care consult service team. So, we'll see who are the team members. Actually, it's a big team, but to start, there must be a core team. The core team must include a consultant, medical officers, and nursing officer, and a supportive staff. Actually, as there are no palliative medicine consultant currently available, any board certified consultant who would like to take the leadership of palliative care consult services, in fact, in addition to his normal duties, could be appointed by the director or head of the institution. It's voluntary service anyway. But without having a leader, without having a consultant, this palliative care consult services cannot be established. Therefore, it is very crucial to appoint to get a support from a voluntary consultant to work as a leader in the team. However, medical officers and nursing officers must be full-time attached. They can't be actually the proper care cannot be provided by a part-time medical officers or nursing officers. Therefore, it is I am emphasizing medical officer or nursing officer has to be full-time attached to the palliative care consult services. Having a trained medical officers or nursing officers is actually assets and also a resource, but it's not compulsory. There are many palliative care consult services which has started palliative care services without having any training, but they got training. They develop training opportunities after appointing medical officers. And finally, gradually interdisciplinary team to be formulated. That means both from hospital and outside health sector. So this palliative care team is a big team, but there must be a initial core team to be started. The all full team cannot be started at once. So this is a picture from the World Health Organization. So palliative care team consists of lot of people from hospital, from outside, including doctors, nurses, supportive workers, pharmacists, social workers, physiotherapists, volunteers, all working together with the patient and their family. That's why it's called interdisciplinary team. So palliative care provision is a teamwork. This is very important slide. So this is actually the responsibility and the expectation of the head of the institution, because to establish palliative care consult services, actually the head of the institution's wish is very important. Without his contribution, this cannot be established. Therefore, we are expecting head of the institutions to liaise with the consultant to work as a team leader in addition to his or her normal duties. Appoint at least one medical officer and one nursing officer full time to the palliative care consult services. Then provide training opportunities for those appointed officers. That can be arranged actually with the help of the cancer control program and the national NCD unit. If any trained, this is also third bullet is very, very important. If any trained medical officer or nursing officer on palliative care is available, especially diploma medical officers and nursing officers available at the institution, they must be assigned or attached to the palliative care consult services. This has been in black and white in the circular. So we are expecting all head of institution to pay special attention on this. And then gradually an interdisciplinary team or supportive members to be appointed, like social service officers if available, counselors if available in the hospital, pharmacists is very important to make, especially providing these opioid medications. And the last bullet is also important. There must be some male and female healthcare assistants also must be available in the palliative care consult services. So these are the main responsibilities, and there are another three main responsibilities shown in the next slide. Is not a ward really. So it's a separate unit. Palliative care consult service is not a ward. So we need a small location to conduct the palliative care consult services. It usually in hospital is conducted as a part of the ward, but it's not the ideal way according to the circular, and it's not that successful also, because all other consultants are expected to refer their patients to this unit. Therefore, it's always good to have a separate unit. Therefore, I think again, responsibility, one of the main responsibility of the head of institution is to find a place, suitable location to conduct the palliative care consult services as a separate unit, and also basic equipment. As far as equipments are concerned, it's not huge things, but just a one bed, and especially facilities to have to conduct family meetings. A large chair with round table chair with approximately 7 to 8 chairs, and that kind of cupboards and tables for doctors and nurses to keep the file. So that kind of small setup is more than adequate for the initial start. And also essential medicine for palliative care to be made available. That's also, I think, going to be as a responsibility of the head. And training needs to be identified and facilitate palliative care teams to conduct the training to health staff. So these are the main responsibilities of the head of the institution. And finally, I would like to show you this a bit complicated maybe for the people who look in this at first time. So this is the palliative care pathway. This is actually almost finished, but still under development. So we have developed this with lots of series of consultations. This is my last slide, and I wanted to show where this palliative care consult service is. So you can see on your one side green color, other side the uh, uh, violet color. So in green color, you can see palliative care consult services at tertiary and secondary hospitals. You can see from where patients are getting to this palliative care consult services. That is from the consultant. Patients who need palliative care are referred by consultants from specialized unit, right? So once they come to the palliative care consult services, so they, as a team, they will provide the holistic care. That's what I discussed so far. And thereafter, once the patient is discharged from the original ward, then palliative care consult services, the team has to make a proper referral, patient referral, using adult palliative care records. Actually, that's been developed and still underway. Development is underway. So it has the patient has to send to the primary care level with that proper plan. Then actually the in charge of this primary medical care institution can provide proper palliative care. Otherwise, readmissions and unnecessary admissions will be happening. And I think, and also in the bottom, you can see MONCD, RDHS level. They are the health coordinators at the district level, and well below and national level, NCD unit and the NCCP coordinates whole system. That's it about the palliative care consult services and how it is placed in the palliative care pathway. And therefore, palliative care consult services is a crucial point, step to provide effective palliative care services. Thank you.